Pediatric Symptoms Checklist is a screening tool that can help primary care providers assess the likelihood for finding mental health issues. The purpose of this tool is to identify symptoms related to attention, internalization, such as anxiety or mood disorders, and externalization, such as behavioral disorders like ODD. After administering this tool, primary care physicians can score the questions to determine who is at risk and can benefit from interventions. This tool is not for diagnosis, but can help bring to the surface any difficulties the child is having with attention, externalization, or internalization symptoms. Here is an example of how to administer the tool to patients. Hi, Mr. Stevens, I'm Alyssa. I'm going to ask you to fill out a form today that takes a look into how your daughter's been doing. Okay? Can you please go through each item and rate sometimes, often, or never if they're true for your daughter? For example, the first one is fidgety and unable to sit still. Is this true for Cynthia sometimes, often, or never?
All the time, absolutely. So I would check often?
Yes. Okay, and please let me know if you have any questions.
Okay, thank you.
This is the completed PSC-17. I will now score the answers and identify whether or not there is further need for interventions or diagnostics. In tallying up each column, Cynthia scored a 4 in internalization, 8 in attention, and a 5 in externalization. As the cutoff number is 7 for attention, this indicates that Cynthia is at risk for an attentional disorder. There are also 2 other tools that may further identify the precise issues. We will go over these as well.